respond to Mr. McGrath's point that publicly traded healthcare companies essentially describe to Wall Street their strategy is denying claims and raising premiums above the cost of inflation. That doesn't seem to be a cost-saving strategy.
Sir, I don't. Our members are organized to provide the highest quality care for the lowest price to consumers and to business purchasers. Our members are very, very clear both about their fiduciary responsibilities, their issues with respect to maintaining solvency and maintaining responsibility for consumers. I don't know.
So they have no responsibility to their shareholders?
I said that they have fiduciary responsibility. They have responsibilities with respect to solvency, because we don't want hundreds of AIGs around the country. That would increase significant volatility and create a situation that would be untenable. We found that situation.
What's their primary responsibility? Their fiduciary responsibility is their shareholders.
Their primary responsibility is to, in a going concern, is whether you're for-profit or not-for-profit, to do the job that you have been asked to do by people who purchase your product. The people who purchase our products are consumers and businesses, and they expect that you're going to offer coverage to them. That's job one, to actually provide that. A part of that also is maintaining a going concern, whether you're for-profit or not-for-profit. So all of these issues are very important, and we take them very seriously.
So there's no distinction between a for-profit insurance company and a not-for-profit insurance company in the way they operate?
Both types of insurance companies have to have a profit to be able to maintain operations, as you know. And I think that unfortunately we're having a discussion about profits that are relatively small.
We're having a discussion about firms that go to the street and say our strategy is we're going to deny claims and raise premiums above the medical inflation.
I thought I'd said this, and I apologize if I didn't say it, but I don't know of any company that has gone to Wall Street that says that it is in business to deny claims.
Mr. McGrath, do you have any?
I believe I mean, I'd be happy to. Well, let me first of all be clear. In no way, going forward.
You're not in any way insinuating the operations of these companies.
No, but to be clear, there are companies operating in states around the country that have loss ratios of 50%, in some cases less. All I would submit is that if what Ms. Ignani is saying is true, and I have no reason to doubt her, of course, then rate review will only enhance that and support that position. I do want to clarify, AIG was not an insurance company problem. By the way, I know, Senator Reid, you're familiar with that discussion. But on the health insurance side, there are companies that have submitted to stock analysts and others exactly that statement. They will deliver value by holding the line on claims and increasing premiums above medical inflation.
Well, I've got to yield my time, but it seems to me that move on. I'll move on, but everything I hear from doctors, hospitals, and everything else is insurance companies deny claims and raise premiums. So, thank you.